over a suspected case of Ebola in Kericho County in the west of the country. The patient is said to have exhibited suspected symptoms of the disease and is now in an isolation ward in hospital. The patient is said to have travelled from Uganda over the weekend. About 1,400 people have died since the outbreak began in the Democratic Republic of Congo last August. Last week, several cases were confirmed in Uganda amongst people who had recently crossed over from the DRC. Ugandan authorities say that they've trained close to 5,000 health workers in anticipation of a situation just like this. The World Health Organization says that the persistence of Congo's Ebola outbreak and its deadly spread to Uganda does not currently qualify as an international public health emergency. Well, for more on the situation in Kenya, we're now joined on the line by our Kenya correspondent, Sarah Kimani. Sarah, thanks very much indeed for joining us. How much more do we know about this patient in West Kenya? Are the blood samples still being tested? What do we know?
Well, we know that she's a 36-year-old lady who was at a hospital in the west of the country in a place called Kericho. And we understand that she had symptoms of headache and vomiting. But we also know that she had traveled from the border town of Malava, that is on the border of Kenya and Uganda. And now, the minute that she mentioned that she had been on the border of Kenya and Uganda, that's when doctors at the hospital decided to take precaution, and so they put her in an isolation ward. But we now understand that they have also put 3 more people in isolation, and these are the 3 people who are in contact with her. They include her husband and 2 friends. Now, blood samples are still being analyzed, but the Minister of Health, Cecily Kariuki, has said that initial reports indicate that this may actually not be Ebola, and so, but she says that they will continue with the surveillance and investigations, and also they'll continue testing the blood samples here in Nairobi at a research institute, the National Research Institute, to rule out Ebola completely.
Are there any precautions that the Kenyan authorities are undergoing at the moment, just in case? It does seem that they were quite quick to act just on the suspicion based on where she had travelled, which sort of leads us to the assumption that they're highly trained to look out for these kinds of things.
Indeed, yes, Kenya is quite lucky in that sense because it had sent some medical experts to Liberia and Sierra Leone under the African Union CDC program. And so these experts now, 21 of them, have been sent to various points of entry in the country so that they can help in the vigilance that is ongoing in the country and also in surveillance. We understand that the Kenyan government, according to the Minister for Health, has sent out just over 200 staff members on its border points. The one that I can authoritatively talk about is the entry into the country through the Jomo Kenyatta International Airport. When you get in, the first thing you notice is that there are cameras that are stationed at the entry point, and each of them will take your temperatures. And if it happens that you're just above the 39 degrees Celsius mark, then you will be called into a room where you'll be questioned in terms of where were you last, who did you get into contact with. So they're also very keen on the vaccination card. So anybody who comes into the country without a yellow fever certificate is finding it very difficult to get through the border points, and most of them are actually getting their jobs done again, even if you have been had the vaccination before.
Is there a lot of movement in the region in the west of the country, near Kericho, where people are moving around quite a bit, that they can come into contact with the Ebola virus?
Yes, Kericho is a bit far from the border with Uganda, but indeed, you know the way the continent is, these borders are actually not there's no quite, a distinct line. People between Uganda and Kenya cross all the time. In the morning, you'll find a market woman will be doing her business on the Ugandan side, and in the evening, she'll go back home to the family. The same thing with the Ugandan side. Remember also that Uganda is a landlocked country, and so all the goods coming into Uganda going into Uganda will have passed through Kenya from the port of Mombasa. So if any of those drivers would have gone all the way to the Democratic Republic of Congo, which is also landlocked, then they may be and assume they get into contact with people with Ebola, then it would easily cross into Kenya. Diseases have no borders, as the Minister of Health said this morning, and so it is for this reason that they have increased surveillance. And indeed, some people have families across the border, so that's why you see the surveillance and also the high alert, even among residents, when it was announced that there was a suspected case of Ebola.
All right, are people in Kenya nervous at all, or are they feeling quite safe at the moment?
Well, people have the information, and indeed we understand there was quite some panic at the Kericho County Hospital where this lady was isolated and admitted in the morning. We even understand that some people actually ran away from hospital fearing that the deadly virus may actually spread to them. But now government is working to try and see that the information is well passed and that they are able to contain panic in case indeed it turns out to be positive.
All right, Sarah Kimani, we're going to leave it there. Asante Sana, that's our correspondent in Nairobi there, talking to us about what looks like a precaution more than anything else at this stage. A woman presenting with symptoms had travelled near an area on the border with Uganda and the DRC. And so authorities in Western Kenya straight away, taking no chances, quarantined her plus her husband and people that she had come into contact with. But her blood's being tested at the moment and it's not yet confirmed. But just to say, Kenya is on the eastern part of the continent. In between you find Uganda, and then the DRC on the west of Uganda is where the Ebola crisis at the moment is playing out. So there's quite a bit of distance between Kenya and DRC, with Uganda in between. Uganda, of course, seems to have contained the infections that came through on the west of their country. So perhaps not a high risk, but certainly the Kenyan authorities taking all the precautions necessary. Palesa?